afternoon or morning, depending on where you are in the world today. I'm Bob Dempsey, and I have the honor of chairing the Foundation for International Education in Neurological Surgery. One of the most important things we do is keeping track of our various fellows, graduates around the world, and do a virtual visiting professor program quarterly. This allows us to gather as a group and to also have a library of resources of really brilliant people talking about something that's dear to them about neurosurgery. These are moderated by one of our former fellows, a Fiends Fellow or the CLAC Fellows as part of their education, and they come back as alumni and are grateful to participate. So today we have two very wonderful people. Joel Sanabria from Paraguay is a graduate of the Fiends Bassett program, having done additional training in Canada. He'll be introducing our guest speaker today. We're very honored to have Charlie Teo, who is one of the truly global neurosurgeons in both in his intellect and his ideas, but also in his, he talks and walks the walk because he travels and takes care of people worldwide. We have that opportunity for him to tell us about his life as a global neurosurgeon, which I think will be a fascinating perspective. And we'll leave time for questions and certainly encourage them either in the chat or Joel will call on people. This will all be recorded and available on our website as part of our library of these visiting professors. So with that introduction, I'm very excited to have Joel introduce our guest speaker today.
Thank you, Dr. Dempsey. Well, Dr. Charlie Teo is a globally recognized neurosurgeon acclaimed for his pioneering work in complex brain surgeries. His expertise and innovative techniques have positioned him as a leading figure in neurosurgery, earning him widespread recognition and respect around the world. Dr. Teo's contributions have not only advanced the field, but also brought hope to the patients facing the most challenging and previously inoperable brain conditions. So, Dr. Teo, you have the word. We're eager to hear you.
Oh, that's lovely. Well, what a lovely introduction. Firstly, thank you very much, Bob. It's kind of surreal being introduced by one of the pioneers and stalwarts and innovators of global neurosurgery, but it's a great honor and great privilege to be here. Well, look, where do I start? I'm not quite sure what I was meant to talk about, so I just thought I'd give a brief introduction of who I am, how I've got to this position, and some of the lessons I've learned along the way. So I'm just going to share my screen, and hopefully you'll find it interesting. Okay. Well, the first thing is, I guess many of you are asking why I've got to this situation where I no longer work in Australia, my home country, but I work all around the world. And I guess it's multifactorial. It all started when I was a young boy, and it all ended about 4 or 5 years ago. I guess it's in the genes because my parents were very much the travelers and global citizens. My mother was half Chinese, half Malaysian, who moved away from Singapore, where she was born, for a better life, and so did my father. And they encouraged this traveling. In fact, I can remember traveling on a plane as a young boy. I can't have been more than about 4 or 5 years old, being dressed up in a little suit, wearing a tie, getting on a BOAC, British Airlines flight, and traveling the world as a young lad. And I presume that the bug was deposited then. That yearning to travel the world and be, I guess, dissatisfied with staying in the one spot carried right through. And in fact, as a university student, I almost failed medicine because for my final year exams, I was stuck in Mexico, and I can remember not being able to get back I probably could have got back, but I chose not to get back for my final exams. I traveled to all sorts of remote places. That's me on the left in the Yucatan, the peninsula. That's me on the right doing a fellowship in Sweden, and in the middle there, hiring a car and just traveling America. Well, it's one thing having the travel bug, but it's also a good thing to have a base. And I enjoyed a very, I don't know, fulfilling and in many ways unexpected career in Australia for almost 30 years. Many of you know that I did a fellowship in America. I'm sure Bob knows that. I was with Almefti and Yazgul in Little Rock, Arkansas. And again, I enjoyed a pretty good career over there in America for 10 years, but then returned to Australia. How did it all come about? Well, thankfully, I've done a lot of work overseas. Like Bob said, as a young neurosurgeon, I started working in developing countries back in 1989. So that's over 35-year career of voluntary work in developing countries. I guess for the younger neurosurgeons listening to this, it's not difficult to operate overseas. Some of the ratios of neurosurgeons to population are absolutely abysmal. And in sub-Saharan Africa, for example, you've got one neurosurgeon to every 8 million people. So please don't think there's not a need. There's an absolute need for good neurosurgeons to practice overseas, and it's incredibly satisfying. And as you'll see from this talk, it's not only satisfying, but it's rewarding and supporting to you in your professional career. I first started in Peru. Oh, this is me in Vietnam. And I guess the first lesson I'd like to teach you is if you are going to become a global neurosurgeon and practice around the world, you really need someone to support you. You need someone who has a similar way of thinking about treating your patients with autonomy and respect, a similar way of operating, i.e. minimally invasive techniques, and an ethical background so that they don't mind looking after your patients when you leave, because you can't stay there forever. So I often go to a country, operate one day and leave the next day. And some people say that's irresponsible, but it's not if you're leaving the patient in the care of someone who's like-minded and who shares the same vision as you. So in every country in which I've operated, there's always this one shining light, this one person who goes, look, I'm going to drop the politics, I'm going to drop my ego, I'm going to drop everything for the betterment of my patient. And invite this man to operate here, learn from him, accept his approach to patients, and support him. So in Vietnam, it's this man here who helped me operate in not only Hanoi, but also other cities in Vietnam. In Cuba, I received a distinguished service award from the Cuban government for helping introduce neuroendoscopy to Cuba, and this was our team in which we were the first to perform endonasal endoscopic surgery in Cuba. Again, we were supported by this beautiful couple who were a husband and wife neurosurgery team. And again, if it wasn't for them, we would never have got started in Cuba. My first country in which I volunteered was Lima, Peru. And at that time, I was a pediatric neurosurgeon working out of Little Rock, Arkansas. And so I'm very proud to say that I was the first person to set up a pediatric neurosurgery course that ran for almost 2 years with visiting neurosurgeons from North America, helping me train the pediatric neurosurgeons in Peru. And once again, if it wasn't for these two beautiful people, it would never have happened, who remain dedicated to this day to the betterment and advancement of neurosurgery in Peru. In India, I helped set up a private hospital that offers a pro bono charity a service to the poor. And that's in a state called Madhya Pradesh, which is one of the central states in India. and in a town called Jabalpur, which did not have a good neurosurgery service until we set up this hospital. The hospital started off as an orthopedic hospital and then was converted into a neurosurgery orthopedic hospital by a man called Ashish, one of my previous fellows. And Ashish basically put his all his efforts into setting up this hospital and developing a service that could offer patients in Jabalpur advanced neurosurgery. I was very honoured to be working and teaching at AIMS, the All India Institute in Delhi, under the tutelage and support of this man here, who invited me there for many years to operate and to teach their neurosurgeons. It is a very prestigious centre. It has won many awards globally as being an efficient and hospital of excellence throughout the world. You can see why they have so much experience. This is the outpatient lineup outside the hospital at 0800 hours in the morning of people just waiting to get in. And I'm talking about people, thousands of people waiting to get into the hospital just for a neurosurgery consult. They run 11 operating rooms 7 days a week continuously, and the wealth of knowledge that these people have gathered is pretty amazing. And here's a man that essentially ran it for many, many years. He's now working in Jaipur, and a brilliant person, a brilliant human being, and again, incredibly supportive to my career. I've also worked in North Korea, teaching, not operating, but teaching. Again, incredibly fulfilling because these people are yearning for information. And when we took a team to North Korea, they absorbed the knowledge with like a wet sponge. Recently, I was in Cambodia, in Phnom Penh, again, a country that sadly in dire straits when it comes to funding for healthcare in the public system. The private system works pretty well, but the public system is poorly funded. They don't have a drill, a very rudimentary microscope, and surgeons who are 100% dedicated but don't have the support that they require. Again, incredibly busy, but people who are willing to dedicate their lives to neurosurgery. This is the man that made it all happen. If you're thinking about operating in developing countries, you have to be prepared to see pathology that you might not have seen in your own country. And certainly there's no lack of it. Trauma is unusual. In sub-Saharan Africa, there are many penetrating trauma wounds. In many of the other countries, patients present at end stage in terrible states. And there are conditions that I saw that I've never seen again, but only see in developing countries. You can make a huge difference, and this was me operating in Peru when there was no operating microscope, no general anesthetic ventilator machine in the operating room, just hand bagging, no drill, and yet you can get a case like this and still, with good surgical technique, enjoy pretty good results using rudimentary instruments, no drill, no microscope. Even complex cases like this craniopharyngoma, the girl was blind, so it made surgery a little bit easier, but nevertheless, she still had her hypopituitary axis, hypothalamic pituitary axis, and so we did have to be very careful, and you can still get a good result using keyhole techniques with complete resection, even in a developing country. Relationships are incredibly important. I can't tell you how important they are because at the end of the day, like I say, it's impossible to be a global neurosurgeon without the support of your colleagues. I'm very lucky to have started a fellowship many years ago, and that fellowship gained an excellent reputation. We had fellows come for either 6 months to 2 years, and they came from every institution in the world to train in minimally invasive techniques. Some of those fellows have remained very good friends and great colleagues. Sadly, others have separated themselves from me because of the negative media. And again, the lesson you learn is that you know who your friends are at the end of the day. And that's quite liberating, actually. So I've trained the neurosurgeons from some of the best centers in the world, like Harvard and Yale and UCSF and Barrow Neurological Institute, Karolinska, many of the institutes in Europe and Asia have all trained in this fellowship over the last 35 years. I guess some of the best friends I've ever made have been neurosurgeons and colleagues from overseas. And I'm very proud to have made friends, and they've remained very good and supportive friends over the years. If I could underscore some of them, this is a guy called Yo Sing Se, and I really want to underscore my friendship with him. This man has put aside all politics and egos and invited me to operate in Singapore many years ago as a Yo Gim Seng fellow. He is a brilliant man, a talented surgeon. Well, you also have to have the right circumstances. I don't think I could travel as much as I am now and operating as a global neurosurgeon if I had a young family who needed me around. Those of you who have older children know that there comes a time when you want them to be dependent on you and to sort of need you, but you've spent your entire life making them learn to be independent, and soon they escape the coop and they become very independent individuals. So my 4 daughters are now 4 young women, all incredibly independent. They have their own lives, their own children, their own careers. And I sat around thinking, well, I don't think they need me anymore. And they certainly don't need my presence. They might need my emotional presence, but they don't see my physical presence. And that gave me permission then to travel the world and become a global neurosurgeon. What's life like as a global neurosurgeon? Well, I've already said it's incredibly rewarding, and it is. I can't tell you how rewarding it is. I don't know, it's almost like you can give them fish to eat, or you can teach them how to fish. And that's the feeling I get. The feeling I get is that when I was in Australia, I was helping individuals, and I was helping keeping them alive and keeping their families together and giving them hope. But when you're overseas operating and teaching another neurosurgeon or teaching an entire nation, you feel like you're teaching them how to fish, and you're really spreading the word and making a global difference. It requires living out of a suitcase because you're constantly on the move, and you have to up and go overseas at quick notice. I just returned from Europe yesterday, and now I have a patient with a GBM that probably won't wait for after Christmas. I'm going to have to fly back to Europe to operate on that patient in about 3 or 4 days' time. So that's 5 days back in Australia, 28 hours of traveling, just so that I can keep this guy alive before Christmas. These are the places where I have clinical privileges currently. I've operated on many different continents in many different countries with temporary privileges, but currently I operate in 6 different places where I have privileges and amazing support from the chairman of the departments. These are the people who are currently supporting me, and I say this is an absolute prerequisite. It's not a relative prerequisite. If you don't have a person who can manage their ego, be supportive, drop the politics, go in batting for you, then you just can't do it. In India, there's this chap here Ashish Tandon in Jabalpur, who is a great humanitarian, a brilliant surgeon, has a pedigree background at AIMS, and runs the centre in Jabalpur. This man here, many of you I'm sure know, is Ip Cherian, who has been the subject of his own controversy, but really at the end of the day, he is a visionary, has developed an amazing centre in Karad, which is about 6 hours drive south of Mumbai. So it's not the most famous city, but I'm telling you now, it has probably the best, most well-equipped operating room in the world. This man here is Ricardo Diaz-Valle, one of my previous fellows, who again has had a lot of pressure not to let me operate in Spain. In fact, the investigative journalist made many attempts to have me stop operating, even overseas, and this man stood his ground and said, Charlie Teo is a good neurosurgeon who treats his patients well. I will supervise him. I'll make sure that he that we all agree on patient selection, and has been an amazing support system for me in Spain. Alberto is my dear friend from Peru, who now is the head of neurosurgery at the Children's Hospital in San Borja. And again, a beautiful, beautiful person who has given up his private practice to help the impoverished children of Peru. I can't say enough words about this lady here, Ling Feng, who is probably China's highest profile neurosurgeon, and understandably so. She is a true visionary who has the support of the Chinese government in, again, advancing neurosurgery nationally, locally, provincially, and nationally in China. And she has done so by setting up the Ling Feng Institute in many different cities. In fact, she was the chairman of the China INI Institute, the Majid Sami generated institute in Beijing, and now basically dedicates her life to improving the standard of neurosurgery China-wise. You have to be incredibly adaptable, and I guess that's a little bit of an understatement, but it's something I wanted to underscore. You can't be a prima donna neurosurgeon because where you come from may have the best technology and you get good results, and you depend on that technology for those good results. You're just not going to have that support system. Even in developed countries overseas, they may not have the same setup that you have back home. So you have to be incredibly adaptable. You have to be able to turn a craniotomy without a drill necessarily, using jiggly saws. You have to be able to use old microscopes without Contravis stands. You have to be able to operate without a microscope, in fact, if the electricity goes off. I've been operating in South Africa where they have power shortages frequently, and you have to be able to convert from microscope to loops rapidly if you want to maintain a good working environment. There, I don't know who said this, and Bob will probably remember, but a neurosurgeon once gave many talks about knowing your instruments, and he was all about, I forget who it was now, it's from North America. But anyway, he said that, it's really important to be able to operate with about 5 instruments, and everything else is kind of superfluous. And never a truer word has been said when it comes to working in developing countries and globally. I take my instruments with me. I have a set of bipolars, micro instruments. I even put a self-retaining retractor, a curved self-retaining retractor, because many institutions don't have this for keyhole surgery. A sucker regulator that you can use on the table instead of at the wall, and a selection of suckers. And that's basically what I need to perform my surgery and keyhole sort of techniques. Sorry, it's a tray of instruments that can be taken in my backpack, and I won't operate without those instruments in other countries. Look, I was going to say that a relative prerequisite is speaking the local language, but I must say that I converted it to an absolute prerequisite. So I used to use Google Translate. I used to depend on the English the rudimentary English of sometimes one of the members of the team. But too many things are lost in the translation, and too many important things are lost in translation. Important things that really mean a lot when it comes to patient care. Informed consent, for example, and teaching during the operation really does require good translation, which can't be given just with someone with rudimentary English or a Google Translator on your phone. And that comes to the next point, and that is compromise. And so many people say to me, well, how do you operate in all these countries and still get good results, or do you get good results? And the answer is that when you're early on in your career, you tend to compromise a little bit. And what I mean by that is that you compromise in some of the basic principles of surgery and neurosurgery and patient care. It's not difficult to do that. Please, I'm not getting on my hobby horse and saying that, it's easy. It's not easy at all. And in fact, one situation where I compromised a little bit, and I should not have, is this situation here, which put me in a very bad clinical state. So those of you who've operated in developing countries know that they are eager to learn from you. And as a result, they often present to you hundreds of cases so you can choose which case you want to do the next day. So your job is to go through often 100 different cases and say, look, I can only do 6 cases tomorrow. Of those 6 cases, I think these are the ones in which I'm going to teach you the most and in which I'll be most comfortable. And so I'm very comfortable with endonasal pituitary surgery, and they threw this X-ray at me, and it was a pituitary tumor involving the cavernous sinus on the left side. And again, you can see that all the people at the door clambering for your attention, all the neurosurgeons are there throwing these X-rays at you, and it's very easy to drop some of your standards. And so I didn't take a good history of this person. I depended on the very brief history I was given by the neurosurgeon, who said, this is a 46-year-old lady with a pituitary tumor that's involving the left cavernous sinus. Can you do this? And I said, yeah, sure. And so we scheduled her for the next day. This is me operating the next day in a room where there's no one speaking English. So again, I'm compromising. And my fellow came with me, but he was operating in the next room on a difficult meningioma. The neurosurgeon, who was our host neurosurgeon, was operating with him, and I was on my own, operating in a room without anyone speaking English, including the anesthesiologist. Well, the carotid ruptured during the case. I had a carotid rupture that blood shot through the nose, hit the ceiling, and I had to get control of the carotid in this room. Thankfully, I did, and occluded the carotid intraoperatively with a muscle patch, stopped bleeding, got the tumor out. The lady did very well, actually. That's her there. We improved her vision, and she didn't have a stroke. But the error I made was that I didn't take a comprehensive history. It turned out that the lady had had gamma knife treatment to the pituitary tumor, not just once, not just twice, but 3 gamma knife treatments to the one carotid, or the one side of the pituitary gland. And so you can imagine what that carotid artery looked like. It had a tissue paper thin wall, and all it took was for me to remove the tumor and the carotid ruptured. That whole thing could have been avoided if I'd obeyed some of the principles that I'm trying to teach you now, and that is, don't compromise in surgical tenets, good surgical and patient care, i.e. taking a history, examining the patient, knowing the patient, knowing the tumor, and knowing the technique. And if you get it all right, like I say, you can enjoy an amazingly fulfilling career with colleagues and good friends all across the world. And these are just some examples of me operating in Germany with Nikolai Hopf when he was in Stuttgart, in Sweden with one of my previous fellows, in Graz, in Luxembourg, and the list goes on and on and on, of amazing colleagues and an amazing career. Again, you have to be prepared for tumors that are incredibly large and incredibly challenging. gone are the days of small acoustic neuromas in these developing countries. They're all large, and they all present their own challenges. Tumours that I haven't seen in many other countries because patients present very late, all very large and all very challenging. Oh, I could just keep going. I could keep showing you these amazing tumours. Surprisingly, those of you who followed my career and know that I'm very much into minimally invasive keyhole surgery, the principles of keyhole surgery still stand, even without a microscope or even without frameless stereotactic navigation and guidance. You can still practice minimally invasive techniques, even in developing countries with limited resources. And many of those large tumours that I just showed you were taken out still through mini craniotomies successfully. Well, you need to be fit. Now, I'm not quite sure what that means because you have to be emotionally fit, but more than that, you have to be physically fit. It's incredibly challenging, and it's not good for your immune system traveling the world and changing time zones every few days. So I would implore you again that if you are considering a life as a global neurosurgeon, you maintain good physical core strength. The way I do that is I always take my swimming trunks and I use a hotel pool. I never use elevators, and I always try and walk upstairs and go for an early morning walk wherever I am in the world, so that I can maintain a level of fitness that is required if you're going to be traveling the world and doing long cases. But incredibly rewarding because you not only learn from your colleagues, you not only enjoy camaraderie, but you also learn the different cultures in every country in which you operate and visit. This is me last week in Hungary, catching up with good friends from years and years and years ago, enjoying good food, uh, enjoying the local culture, uh, and operating and teaching in Budapest. That's me with my team in the Middle East. This is in China, where they treat you like some sort of prodigal son, and they always lay on amazing feasts. And you also get to meet pretty amazing people. I used to take my children with me when I was traveling overseas so I could spend time with them. You can see that she wasn't really that interested in the neurosurgery. I've managed to meet many politicians. I almost met Fidel Castro when I was in Cuba, but he died about a week before our scheduled meeting. I've met the Dalai Lama, had lunch with him, many prime ministers and other politicians who equally share a vision of improving neurosurgery in their countries. So, again, rewarding not only from a professional viewpoint, but also from a social and emotional viewpoint, an incredibly rewarding career. I guess in summary, I'd like to say that I can't encourage you enough to become a global neurosurgeon. It is difficult. I'm not saying it's easy. It takes sacrifice from you and your family because it's time away from them. It's a financial sacrifice because you're not earning money while you're overseas. In fact, you're still paying your overheads in your hometown. So it's challenging. You get out of your comfort zone, but at the end of the day, you are making a difference on a global scale, not just on a local scale. And from an emotional, spiritual viewpoint, it's incredibly rewarding to see that you can make some small differences in the level of neurosurgery and the level of healthcare in the world. Many of you watching are exactly those people. So I'm preaching to the converted. You wouldn't be listening unless you're a member or part of Fiends. Fiends is an amazing society that basically gathers like-minded people around the world to help educate those that are not as fortunate as us. So a call out to Bob Dempsey, a call out to Fiends, and a call out to all those young neurosurgeons out there who are already making sacrifices to become global neurosurgeons. Keep at it. It's great work. You'll love it. It's incredibly rewarding at the end of the day. And I thank you very much for your attention.
Fantastic, Charlie. Fantastic. Thank you. So much that you've covered, but so very important about don't compromise, talk to the patient, talk to the family, and also know yourself. You can do a lot with a little. Joel, why don't you take it for questions that you might have for Dr. Teo or that you have gathered from the chat or otherwise?
Okay, thank you, Dr. Dempsey. Thank you, Dr. Theo, for this amazing talk. So now it's open for question in the Q&A sections, or you can raise your hands if you want to talk. Dr. Theo, for me, it's amazing to see this concept of a global neurosurgeon. I'm from a developing country, and in my country sometimes comes someone from abroad, and we are like very grateful for those kind of people. And you pass for like for a lot of challenges. If I may think now, the word is like resilience, I think, and that not everybody it's in that position to get to pass to these hard situations like you pass. But I saw a lot of interviews. I saw your TED Talks, and for me, you also inspired a lot of people that is the world is not seeing. Well, and as a global neurosurgeon, I want to know when you arrive to a developing country that don't have any technology, where do you start? Like, what do you think is the first step to do when you arrive? Is like only seeing cases? It's like education. It's what to improve. I think that I will be like very lost if I arrive in a country that I don't know the language and the system and the patients. And how do you address this?
Look, it's a good question, but it's a very complex question. You don't quite understand the complexity of operating in a country in which you are out of your comfort zone. And remember, every country you go to, even if they're more advanced than you, you're going to be out of your comfort zone because you're not surrounded by your team. You're doing things differently. And so what I did was I set myself a few rules, some absolute rules that I could not compromise on. And once you set those rules, then things become a bit clearer in your mind. For example, okay, so I've always said the three major rules of operating in developing countries is, firstly, the need. Do they really need you? And most countries need you. So that's the first thing. The second thing is, do they want you? And I know that sounds a little bit sort of banal, but in fact, it's very important because there are some really good-hearted people out there who want to help, but there are also some surgeons out there in countries who need the help who don't want it. They're very happy maintaining the status quo. They don't want to be challenged. They certainly don't want to look after someone else's patients. And so you need that person who wants you, who's thirsty for you, and who's going to support you when you before you get there and when you leave. And finally, you need the infrastructure. So if you've never operated with loupes, if you've always operated with a microscope, I'd be very reluctant to operate in a country where you don't have a microscope. If you've never used Jiggly saws, again, I'd be reluctant to operate in a country without a drill. So you've got to know your own limits. I was lucky enough to have started neurosurgery back in 1970 something. Oh, gee, 79. So when I started neurosurgery, there was no drills, no microscopes. We operated with our loupes, did burr holes, used Jiggly saws, tied off vessels with silk sutures. It was incredibly primitive. You guys would say it was primitive, but that's how I grew up. I grew up in that sort of environment. And so it makes me very comfortable operating in an environment that doesn't necessarily have a drill and doesn't necessarily have a microscope. But please, your point is very pertinent. Your question is very pertinent. Set your own limits. I will not operate unless there's a head holder. I will not operate unless there is a surgeon who can speak English. I will not operate unless there's someone who's agreed to look after my patients the way I look after my patients when I leave. And if you make some hard and fast rules like that, then hopefully you won't have any disasters and things will go smoothly.
Any
Charlie,
final comment?
this is absolutely wonderful. I think that what you've really showed is that there are good people world over, and there's need world over, and that you be true to what you believe in. And if that involves caring for people, it's going to be, a profession, not work. It's going to be something that, you would do whether they paid you or not, and you would do it for a lifetime, and you'd be proud of it. So I think what you've really showed us is there's something about this worldwide giving that you do that is something to really be the thing you're proud of, which is fantastic. I really want to thank you on behalf of Fiends for what you do and for taking some time for our young people. We will, of course, this is recorded and we will be able to bring it to people worldwide as the fellowships grow and grow. And I really thank you for being with us today. It's been great. Joel, thank you for giving back. You're making the fellowship proud as you go, and we look forward to helping you establish that practice you want in your own
Thank you.
country. It's wonderful. So on behalf of everybody, I really want to thank you all for taking some time out of your day, your night, and it's throughout the world is the beautiful thing about this, and that will continue. Thanks once again.
It's a pleasure. Thank you very much.
My great pleasure. And Jeannie, thanks so very much. We'll sign off now. Thank you.
Bye.
Thank you.
Thank you.
Bye-bye.